22-year-old Devin Cadis of Colorado contracted COVID-19 last August.
Hi.
She immediately went into quarantine and began thinking about recovery.
I definitely was very sick. I was bedridden, had all the symptoms pretty much besides a fever actually.
She soon began to feel better, but then
everything started to go downhill again.
She started experiencing what she calls body crashes.
I couldn't move. My friends had to pick me up physically off the ground and put me in bed. And I couldn't even speak. I was slurring all my words.
The loss of smell, occasional trouble breathing, and brain fog continued into the fall.
I didn't need the answer. I know there weren't answers yet, but I just needed somebody to make sure that I was okay.
Eventually, she landed at UC Health University of Colorado Hospital, one of at least 33 U.S. medical facilities that are meeting this so-called long hauler syndrome head on.
I think it's being recognized as a much bigger problem as people are starting to recover from COVID.
Dr. Natasha Altman helps run this post-COVID clinic, which employs a variety of specialists to try to get a handle on what ails patients like Cadis and help them somehow, some way. Long hauler syndrome is a bizarre, often debilitating byproduct of COVID-19, marked by wildly different symptoms. Doctors don't know what causes it.
There's something that the virus is doing, I think, either to the autonomic nervous system or how it's impacting the heart itself or the other organs as well.
On this day, Altman, a cardiologist, put Cadis through a treadmill stress test to determine whether heart issues were causing her exercise intolerance. Heart muscle inflammation and persistent high heart rates are two post-COVID symptoms. This syndrome affects a wide range of Americans. The nonprofit organization Fair Health found nearly 1/4 of those who contracted COVID-19 experienced at least one new medical condition 1 month after infection, including a number of people who had mild or no symptoms initially.
We have not seen this burden of persistent illness in people who were not hospitalized with this type of respiratory infection previously.
UC Health doctors have found that recumbent exercise, lots of fluid, and time are three things that tend to help their patients.
I would definitely say that one size doesn't fit all.
I would never want this to happen to anybody else. It's been tough.
Nice job.
Cadis, who despite the reluctance of some in the medical community to take long hauler syndrome seriously, has been reassured it's not in her head, it's a real thing.
The fact that I can work out again, the fact that I can smell again, means that I will be back to normal soon.
A month after this interview, she says she's nearly recovered. With the help of this clinic and a COVID-19 vaccine, it appears she's finally shown the disease the door.
Nice meeting you all.
Hendrik, Sybrandy, CGTN, Denver.